Dear honorable members of the European Parliament, dear organizing committee, distinguished panelists, I'm Christina Kyriakopoulou, working at the European Commission at the Research and Innovation Directorate, at the team developing research and innovation policy at the European level on rare diseases. It's a great pleasure to have the opportunity to present to you some highlights of the EU research and innovation programs in supporting the pathway from basic to clinical research and solving the challenges from the research perspective of rare diseases. And if we go to the next slide, I will prepare, I will present in a telegraphic way what type of activities the European Union has been undertaking by implementing multinational collaboration, the model that we have been building in research for decades at the European Union, bringing together the complementary expertise needed with which no individual research institution or country could process alone. So why during the last 15 years, if we go to the next slide, we have been funding and supporting research and innovation consortia with more than 20.4 billion allocated to more than 450 consortia, addressing the research rare disease challenges by implementing and by integrating the field on the European Union. But this more than 20% of this funding goes to advanced therapies, ATMPs development on rare diseases. And why I focus my presentation on rare diseases? Because of the great potential for solving the unmet clinical needs and the lack of huge unmet medical needs in terms of therapies for rare disease, since more than 70% of the ATMPs out of the 15 products approved by the European Medicines Agency concern primarily monogenic rare diseases. So such a huge budget has been allocated to the different steps of the pathway from basic research to clinical research as the basis of medicines development, without a solid understanding of the underlying basic mechanism of the pathophysiology of disease, the discovery of mechanisms of actions. And if I go to the next slide, coupled with a strong research pipeline, we cannot have a cost-effective development of ATMPs in Europe. And here, I just wanted to mention in a very diagrammatic way, at the EU framework programs, we fund substantially basic research, preclinical proof of concept, also support first on human clinical trials and up to phase 1. So this is the development pathway from basic research to clinical research, to clinical development of ATMPs on rare diseases. And if I go, of course, ATMPs have a great potential because traditionally, more than 70 or 60% indicatively of the clinical trials funded also by strong academic institutions. So there is a huge important basic knowledge that we can take stock in order to facilitate more the development. And then I go again to a more the next slide, bringing a pathway of the different actions that we have been developing at the European level on coordination of national and international research funding. And here I want to mention how important is the long-standing commitment that we have at the EU to support the collaboration of national and regional public research funders to jointly come together with more funds mobilizing on research since back in 2006. And this creates a higher level of commitment to support also the unmet medical needs of rare diseases, which are huge, because more than 95% of those diseases, they lack an approved therapy, and here there is a huge potential of the gene therapy model. And if I go to the next slide, if I summarize all these coordination efforts and alignment between the member states, those efforts continue since 2019 with a very important consortium project, the European Joint Programme on Rare Diseases. This project is a prime example of working together with the member states and other research performing organizations in order to tackle the fragmentation of the research resources in Europe, and by doing so, create a stronger research ecosystem of all the relevant actors, allowing to catalyze the rapid translation of the research results into the benefit of people suffering rare diseases. So, and if I go to the next slide, here I would just also telegrammatically say the important coordination actions which we support since 2021, putting a unique opportunity to coordinate the clinical research efforts of the European reference networks on rare diseases, and to be able to facilitate collaboration and increase and strengthening the pathway to clinical research activities. And if I go to the next slide, also it is very well known at the European Union, we have a very, very strong collaboration between public-private collaborations via the joint undertaking on innovative health initiatives, successor of the Innovative Medicine Initiative, in order to allow to support rare disease research in pre-competitive space in partnership with industry. And here there is an example of one of the projects that are running are that are accelerating research and development for rare diseases. And currently, since a few days, an IHI call on strengthening the European ecosystem on advanced therapy medicinal products is just announced, and there is a draft publication of this call topic. And if I go to the next slide, and to the next slide, what it is the vision for the coming years. But it is a very well in a political level. Horizon Europe introduces a new approach to partnerships, the so-called partnerships under Horizon. They have the ambition to create a systemic transformation in the research and innovation ecosystem in order to increase the outcomes of research and have more innovative products to the market, or social innovation to the people that are suffering. And in this perspective, our plan is to have partnerships, a European partnership on rare diseases, together co-developed with our colleagues from the research ministries currently taking on the place, but also in co-creation with the research and innovation community at large. There is a concept paper which published back in February 2022, if you would like to have a look, which puts the general skeleton of some views and ideas of what this partnership could tackle. Most importantly, of course, if I go to the next slide, one of the elements that where we would like to contribute at the European level with the leadership of the member states in co-creation with the research community is ultimately to create or consolidate an effective research and innovation ecosystem on rare diseases, address the fragmentation of research resources and in order to have more effective research translation of research results to clinical practice. And of course, an important concept is patient in the center to address the needs in the different pathways from basic research to therapy development, and with the data revolution, a very important aspect in this perspective. And here I will stop. Thank you very much for your attention.